And before we come back to agenda item 2, let me thank Professor Monti and the Commission members on behalf of this regional committee for the great work achieved during this past year. Since this was a journey initiated by our regional director, I would like to give him the floor for some remarks. Regional Director, floor is yours.
Thank you, Madam Executive President. My final remarks are words of appreciation again, very sincere to our chair, Professor Monti, dear Mario. With this, the work of the Commission concludes, and I must say that I start to miss already our late evening calls, dear Mario. So, if you do not mind, I will give you a call time to time, because really this was a wonderful friendship. I must say a virtual friendship, but thanks to Slovenia, we did have the opportunity to meet physically at the sidelines of the Health System Conference together with Professor Torbica, dear Alexandra. I thank all the commissioners. I count very much on all of you to continue to support us as health champions in the pan-European region. To thank the scientific advisory board members. We felt very, very comfortable with such a leading scientist, and also the WHO staff. This has been an incredible experience. And as I mentioned at the last Commission meeting, I really do plan at the right moment to invite all of you. It will be a post-Commission meeting, but at least one time to come physically together and to hand you personally the appropriate award. Thank you so much, and stay healthy.
Thank you, and we all applaud to you. Now I will lead you back to the agenda item 2 discussions there. And we have a list, and we had the list in the morning, and now we will continue. You can see now the list there, and we will now begin with the statements from Kazakhstan, followed by Montenegro and Romania. So Kazakhstan, the floor is yours. Do we have Kazakhstan connected? If not yet, so is Montenegro or Kazakhstan?
Yes.
Yes, you have the floor.
On behalf of the Kazakhstan, let me
yeah, please.
Emphasize. I'm just sorry, I need to change the language. Sorry. On behalf of the Kazakhstan, on behalf of the Dr. Tsoi, let me provide the statement. So Kazakhstan, like other countries in the European region, has committed significant efforts and essential resources on healthcare system to combating the COVID-19 pandemic. We faced with an issue of providing population access to essential medical care, especially in rural and remote areas. In the period of emergency situations, Kazakhstan aims to provide access for medical services without putting people at the risk of financial hardship. Kazakhstan believes that strengthening primary health care and mobile medical services have the potential to improve access to essential health services both during the COVID-19 pandemic and in the event of other public health emergencies. Thus, we continue implementing the declaration of Astana on primary health care in our country. As the document states, primary health care is a cornerstone of a sustainable health system for universal health coverage and health-related sustainable development goals. We expanded the work of mobile medical complexes, that is to say, polyclinics on the wheel, that allowed us to increase access and quality of medical care for rural population, expand coverage with diagnostic services, vaccinations, medicines in remote areas, and generally to accelerate the development of rural healthcare. Kazakhstan started vaccination against vaccine on February 2021. Currently, we aim to include our vaccine, Kazvac, to the list of medical products approved by the WHO for procurement in an emergency. We implemented the digital vaccination passports. The mutual recognition of vaccination passports with other countries is under negotiation. Kazakhstan supports the WHO initiative on equal access to vaccination. Unfair distribution undermines not only human health, but also the recovery of global economy. We believe that currently population revaccination issue is very relevant. It is necessary to develop approaches to ensure population access to the booster shot of COVID-19 vaccine. Kazakhstan supports all the response to the COVID-19 pandemic lessons learned to date from the European region presented by the regional directors. Thank you very much.
Thank you, Kazakhstan. And then I would like to give the floor to Romania and Montenegro, followed by Romania, and after that, Italy. So, Montenegro, please. If Montenegro is not yet available, then Romania, please, you have the floor.
Director General, Regional Director, Excellencies, ladies and gentlemen, I'm honored to address you today on behalf of the Presidential Administration of Romania. Romania fully realizes itself with the European Union statement. The Regional Committee for Europe is one of the few meetings that have the chance to be as far-reaching and meaningful for the region's health policy. Despite the shared hope of returning to normalcy with secure vaccine coverage, the severity and shocking nature of this health crisis are still vivid and fresh across the region. Dear Regional Director, your leadership in the European region has been, during these unprecedented times, an incredible inspirational model. The decoration you have recently received for merit in rank of commander from the President of Romania, His Excellency Klaus Iohannis, is a sign of high appreciation for your firm commitment. But alone, your leadership is not enough. Romania believes this type of crisis is a threat to security and not something that health ministers can work out. By addressing this pandemic at the highest level of the state, thanks to the steadfast leadership of President Iohannis, we have prevented the country from facing a tragedy. Strong leadership is essential both in crisis situations and for achieving lasting health outcomes. Romania welcomes and looks forward to the work of the Pan-European Leadership Academy to mobilize transformation in the region. Our task is to commit ourselves to a process through which we can reach a very clear agenda, although not so easy to achieve, but very powerful, which in fact should create a system resilient to the unforeseen. While facing a pandemic of such magnitude, our health workers have shown the extraordinary power of selfless acts despite the dearth of human resources and structural weaknesses within our health systems. We need to equip them properly so that their mental well-being is protected. The Pan-European Mental Health Coalition is therefore a timely and crucial initiative to guide the national efforts. A new reinforced health security architecture must guide our future preparedness. But let's not think about health through the narrow lens of infection diseases, because silent pandemics, but even more aggressive, will shock the world's conscience if not addressed properly. Cancer is the best example we can think of. The common sense of shared rules and coordinated action are values that should underpin better and fairer reconstruction. Enhanced cooperation between the WHO regional office and the European Union institution and meaningful joint projects should be a priority to pool efforts to improve health across Europe. Our actions have created an unhealthy relationship with the environment. We have to rethink our approach if we want to have a green build back. The COVID-19 pandemic had devastating consequences worldwide. To exit the pandemic, solidarity is key. Vaccine sharing is a global necessity. As emergency donor, Romania deployed almost 2 million doses of vaccine to its neighboring partners such as Republica Moldova, Ukraine, Serbia, and to far distant countries such as Vietnam, South Korea, Egypt, and Tunisia. We believe this is the way to ensure we are all safe in the shortest time possible. Ultimately, we need to draft policies not only for the people, but also policies that connect people. United for Health, with a shared commitment to continue working together in partnership, we can make a difference. Thank you.
Thank you, Romania. Do we have Montenegro? Connection to Montenegro? If not, I would like to give the floor to Italy, and because we have interpreters available only until 6 o'clock, and there is still a right of reply asked. So after Italy, we will then suspend the discussion then tomorrow. But Italy, are you there?
Dear Director General, dear Regional Director, thank you very much for this opportunity of discussion. Italy aligns itself to the statement delivered on behalf of European Union and its member states. We just come from 2 important days in Roma. The 5th and 6th of September, we had the G20 ministerial meetings of the Ministers of Health. It has been a very important moment. We tried to give a message of unity, a message of common vision on the necessity to invest more on global health. What we learned from the COVID lesson, from these very hard days that we had all over the world, is exactly that we have to put more energies in the development of our health systems. We have to invest more in our health workers, and we have to work together, because there is no difference between our countries in this incredible challenge against the virus. I think that we have a very good meeting, and the result of a common declaration signed by all the 20 countries of the G20, I think was very important to help us to give a strong message to all the public opinion. In this challenge, I think there is a crucial role that has to be played by WHO. We strongly believe in WHO, and we want to work to make it stronger with all of you. And I'm sure that even this event, this moment of discussion, can help us to make always a stronger WHO. Thank you very much.
Thank you. I really apologize that we have to now suspend the discussion for tomorrow, and we will have the countries on the list you see there, and then we have also 4 international partners who will be given the floor tomorrow also. Then also full list for tomorrow. I would like to suggest that we begin tomorrow morning at 8 o'clock, so sharp 8 o'clock tomorrow morning. We continue then the discussion of agenda item 2. And because we had the rule of reply demand from our Russian Federation earlier in the morning, I would like to have that dialogue in the end of today's discussion, but before that, Director General, the floor is yours.
Thank you very much, Executive President. So, dear Member States, Thank you for commending the tireless work of our country offices, the GDOs, and the regional office. That means a lot to us. I appreciate that you're underlying the need and the role for a strong WHO and a strong regional office. Also appreciate the commitment to a human rights-based, transparent, equitable, intersectoral whole of government and One Health approach for dealing rapidly and effectively with all types of health emergencies, including tackling AMR. I am very grateful to the European Union and to all countries who have supported with distribution of vaccines, including essential support to COVAX and ACT-A. As several of you have highlighted, global solidarity on dose sharing is critical. Alongside the fact, of course, that countries are responsible to protect its own populations. My narrative always has been from the beginning that international solidarity and national responsibility do not exclude each other. And that's what the member states are showing. That makes me very proud. I'm also very proud of the role played by many countries in the region for the contribution both through dose sharing and contribution to COVAX. But I would like to call on you as region director to do more. We had the Director General of the International Federation of Pharmaceutical Manufacturers with us a week ago, and he gave a press release the day after that between now and the end of the year, there will be 1.2 billion excess doses. So the issue first and foremost is the one of political commitment and coordination to get those 1.2 billion to countries which need them, be it in the region, be it globally. And one of the issues, dear member states, is that countries which would like to donate are waiting a little bit too long, too close to the expiry date before donating. And that's very difficult because many lower middle income countries or middle income countries cannot absorb so quickly so many doses. So we need your support there. And we will do our share together with partners like UNICEF to work with countries on country readiness. Then on Pillar 1, UHC. Building back better undoubtedly requires us to strengthen our health system resilience. We heard this time and again, based on a strong primary healthcare. And shortly we'll publish a volume on this topic with the European Observatory on Health System and Policies. And I would like to commend here its director, Dr. Joseph Figueras, for working very closely with our office. I am concerned about the level of disruption in health services experienced during the pandemic, and we must not let this happen again. We need dual-track health services. And I urge that we spare no effort to bring our health services back on track. This was the second part of my TED Talk, to go now to future health and well-being. But the huge challenge we face is scarce health workforce. This is for all countries and all regions. Together we must invest and protect our health workforce. And I'm looking forward to hear more in our ministerial briefing on Friday. We have a ministerial briefing on this very important topic because let's not forget, we're still in the year of the health and social care workforce, 2020. We need to find ways to utilize digital technologies to complement and support the activities of our health workforce, but also to be more brave in task shifting. Sometimes we are still a little bit too conservative from the medical workforce to shift tasks to nurses, to community workers, and there are many good examples in our region. Many countries are strengthening their primary healthcare systems, having realized that the role of primary healthcare during the pandemic was crucial. We heard it from the Minister of Health from Ireland and Dr. Clemens Auer from Austria. Ukraine described very well how through WHO support, this special initiative on mental health is seeking to strengthen mental health services through primary and community care. And well done, Ukraine. Also Poland mentioned this, particularly for children. The importance of big data and artificial intelligence in transforming our abilities to prevent and control disease is an opportunity we must seize. And we're all very much looking forward to the conference being hosted by the Russian Federation later this year on this. Digital transformation also requires us to take a fresh approach in strengthening the quality of healthcare in a digital era. In November, we'll have a meeting of the European and world top experts on quality of care organized by the Athens Quality of Care Office. Now I go to pillar number 2 of GPW and EPW, COVID, in the emergencies. I heard support for the full implementation of the IHR, but also remember, we do have an elephant in the room, namely, what happens if there is non-observance by the signatories? This cannot be solved by WHO, can only be solved by the member states, and this should include access by WHO experts for country missions, including first and foremost, access to data. Thanks to all those countries who helped us to fly over closed borders. This was a very stressful moment for us because countries were asking for our support and the borders were closed. There was no humanitarian corridor, and a number of countries really helped us, including with military planes, to get our workforce to the red zones. Thank you so much. Global health security is a chain which is only as strong as its weakest link. Building national and regional capacities are the key, and with this I reiterate my thanks to Turkey for opening its heart and home to host our GDO on emergency and humanitarian preparedness. Teşekkür ederim, Minister Koja. Need to build our capacity to share and translate data to policy. And thank you, Minister Jens Spahn. In fact, you spoke 2 times today, so we heard very well your message. For your support to WHO in setting up the hub on pandemic and epidemic intelligence in Berlin. And we welcome the commitment of Norway to build evidence on public health and social measures and interventions. Then some specific points on vaccines beyond vaccine sharing and solidarity. Digital tools have enabled us to implement mutual recognition of vaccine certificates for available and approved vaccines. Of course, countries are sovereign to make a decision to recognize vaccines approved by the national regulatory authorities. Trust in the population is critical in COVID-19 vaccination, and transparency to decision-making based on evidence, not on ideology or politics. WHO urges that vaccination should not be seen as a prerequisite for travel, because this only increases inequity. Evidence is evolving on the level of antibodies and its relevance to the vaccination and disease. And that's why WHO, through its independent review by its experts, will review the information and provide guidance to you, the member states. Pillar number 3, NCDs, health and well-being. Strong health and strong economy go hand in hand. Malta and Finland mentioned. Pandemic illustrated starkly the importance of closing the gap, prioritizing the importance of health equity, Finland and Sweden. And the pandemic has disproportionately affected vulnerable groups, such as prisons. Please attend a fantastic, I think it's even the very last technical briefing on Friday afternoon, and we have the European Commissioner of Justice, Mr. Didier Reynders, for the first time, who will also address on the topic of health in prisons. We are very grateful to the member states who have raised NCDs in their interventions today. 9 out of 10 people still die of NCDs in the region. Despite the pandemic, we must acknowledge the huge burden cardiovascular disease and cancer bring to our region, and its role in the worst outcomes of COVID. Here, I'm very grateful. I was very inspired to hear the United Kingdom, your leadership in the work on obesity, committing through a WHO European network on calorie reduction and sugar intake. That's really great. What an announcement. We are fully committed to ensure that health rights, including sexual and reproductive health rights of women, are fully respected and promoted. In conclusion, thanks all those who emphasized WHO's leadership role in the global health architecture and expressed support for the sustainable financing of WHO. We also heard Minister Roberto Speranza, on the commitment by the G20. Grazie mille. But I also clearly heard that WHO must be fit for purpose in its governance, its performance, and its transparency. As a region director, I will continue not to hesitate to ask our chair of the SRC for ad hoc meetings of the SRC when needed. And thank you so much for the support. As I said in my talk this morning, I'm very passionate about making WHO Europe fit for purpose in a rapidly changing world. My vision for the Europe itself, the office here I mean, is really to have the example globally of a modern, agile, United Nations agency which deliver on your expectations. I'm very grateful to the countries who took the floor to emphasize the importance of the work to review and strengthen WHO Europe's work and presence in countries. I would like to apologize for the member states who wanted to intervene still and the partners, because this is a bit of an exceptional situation that we have to link at cut off. But tomorrow morning there is the opportunity, and then again, Madam Executive President, I'm ready to give a short reply. Thank you.
Thank you, Director General. And I want to inform the delegates that tomorrow Regional Committee will be invited to adopt the draft resolution on the RD's report after we finish the list of speakers. And and now, as we have come to the end of the session for today, I would like to now give the floor to the delegation that requested to exercise its right of reply earlier in the day. And I would like to kindly record delegations to be as brief as possible in delivering a right of reply. So I would now like to give the floor to the delegation of Russia to exercise its right of reply.
Distinguished Regional Director, respected Chair, dear colleagues, I will speak in Russian. Мы пользуемся правом на ответ в связи с заявлением представителей Украины. Сожалеем, что представитель Украины использовал трибуну заседания высокого уровня для политизации дискуссий и озвучивания несоответствующих действительности обвинений в адрес Российской Федерации. Не вдаваясь в суть прозвучащих заявлений, хотели бы отметить, что политические и экономические проблемы Украины, включая всю повестку в области здравоохранения, связаны с нежеланием киевских властей вести продуктивный диалог со своим населением, а также с соседними странами, и решать эти проблемы. Попытки переложить ответственность за решение этих проблем на других едва ли будут способствовать их разрешению. В этой связи вновь призываем делегацию Украины придерживаться тематического профиля дискуссии без ее политизации. Спасибо.
Thank you, Russia. So I think we can now proceed to the closing of today's session. I would like to remind you, of course, thank you for the discussions today, and we will continue tomorrow then 8 o'clock, and I hope that we can go through then agenda 2 and already begin before 9 o'clock. Also the discussion of agenda item 3. So thanks for this day's discussions, and I would like to now wish you all a very relaxing evening and a good night's sleep, and see you then tomorrow 8 sharp the Copenhagen time. So thank you, and the session today is closed.